let me jump in for a sec.
Sure.
I want to make sure I understand this piece here about stenting. When flow
Mm-hmm.
is affected to a certain point, a stent is warranted. I think you mentioned the fact that if we change the lifestyle, we can't reverse the plaque. So let's talk about that. Somebody that wants to go at this purely from lifestyle, diet and lifestyle, can they reverse plaque at all?
What a great question. I knew you were going to ask this question. So, can you reverse the plaque? Okay, doc, I saw these blockages. My FFR is a little abnormal. I'm asymptomatic. Give me something that I can just reverse the plaque because I don't want any stents inside me. And the answer is yes, you can. Now, how much can you regress it? I told you that it's a dynamic state of affairs, right? There's soft plaque and there's hard plaque. Soft plaque can regress. Hard plaques are harder to regress because they are hard. However, within the hard plaque, there's always some soft plaque also. So the answer is yes. With aggressive lifestyle changes, dietary changes, environmental changes, changes in your toxicity, changes in your food, everything else, you can. But the extent is probably, the percentage stenosis is probably very low. That means you can reduce it by maybe 10%. And I've seen that. I've done an angiogram. The plaque is looking like it's 80%. The patient did not want a stent placement because he's relatively asymptomatic and he's very, very motivated to make lifestyle changes. He does it. And for whatever reason, we cath him again 6 months or a year later. And I found that the blockage actually looks a little bit better now. Now, that the regression of that plaque is possible, but don't think that we have a Drano that can just clear away the plaque. This is dangerous thinking. You will regress it somewhat. But I want you to also understand something. The flow in a cylinder is related to the fourth power of its radius. That's Poiseuille's law. We were taught in school, but we've all forgot about it because of the way they teach it to us. We just forget the relevance of it. So when you improve the lumen by 10%, by regressing it a little bit, you're actually improving the flow tremendously. So there is some benefit even in moderate reduction in the percentage stenosis. And the answer is yes, you can regress it, but you cannot get rid of it completely. When you go back and again inside, there will be a narrowing over there. It may be a little bit less, but you need very aggressive lifestyle. You need to know the factors that made that plaque in order to reverse it. You can't just say you got a plaque now, just do A, B, and C. And we're going to come to that because I know you're going to come to that. But you got to know what was driving it. And then if you hone in on those aspects, you can hope that there's going to be some regression. But I've never seen a case where the patient has multiple blockages and serious blockages, come back to an angiogram and they're all gone. I've never seen coronary calcium 400 go to 0. I've seen 400 go to 300. I've seen 1,000 go to 800. I haven't seen 1,000 go to 0. So I just want everybody to know that because once the calcium sets in, there is some turnover, but the turnover is limited. You will get some reduction, but you will not get elimination. Now, it's nice that the numbers go down because that means that the burner's off, that you're not cooking anymore inside. That's good news. Stop cooking your arteries. That is good news that it hasn't increased, but it's not going to go away to 0. When a plaque regresses, it also means that it's metabolically more stable now, that it's not so hot. Like I said, the low attenuation defects that you see on the CT angio, you're not going to see that because it's regressing. So the answer is yes, you can regress it.
And I asked you something similar, but I still need clarity. Say we have somebody right now, middle-aged, they have some plaque, they have some clots. It sounds like most people will have some of that going on. What is the best they're going to hope for, prognosis-wise, with that, if they adopt what we're talking about today?
You will live with your plaque, but you will not die from your plaque. You can live with plaque just because you got coronary calcium in your score. By the way, I've got patients now for 7-8 years that have been following with calcium scores of 4,000. They're still doing fine. So long as you follow an anti-inflammatory lifestyle, anti-inflammatory environment, anti-inflammatory diet, 3 things, then you can live with your plaque and not die from it. You'll die of something else. So yes, the prognosis is good. You got to do this program. Yes, you're going to need some supplements. Yes, you're going to need some antiplatelet agents. Yes, you're going to need to do some dieting, lifestyle changes, circadian rhythm disorders, sleep. You need to do the whole package. Bottom line is, yes, you can live with it. Yes, you can, and you can live a long time with it. Just because you have a calcium score that's high doesn't mean you're going to die. It was the graveyard of what happened then. It's not the graveyard of what's happening now. Now, it's burnt off. It's done. Your inflammatory markers are low. Your LDL particles are nice. Your HDL is high. Your triglycerides are nice and low. Your blood pressure is nice and low. Your CRP level is nice and low. Your MMP levels are nice and low. We didn't even talk about all this, but these are chemicals that you can actually measure. Your interleukin-6 levels are nice and low. You can measure those too. See, you can measure these things. And it's important to do that because you need to know that you're going to be okay. Because otherwise you're going to be living in sympathetic tone all the time, worried, oh, I'm going to die tomorrow. You need peace of mind also to live long. So you can live with that plaque and have peace of mind as well. Get your test done. Get your peace of mind so that you can sleep well and have a great physiology.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
A lot of coronary artery disease is very silent. That plaque is silently sitting there in millions of people without them even knowing. And there are ways to find this out now. We have the technology. It's just not being